How to have a quick and easy labor is probably the most asked question.
It's a great video from her. You can go ahead and watch it. It's about not comparing yourselves, but I wanted to talk about 3 things that evidence shows, like studies, data, the old data thing, show that it can make labor shorter and possibly easier. Of course, this varies person to person, and just because it works for one person or in one study doesn't mean it will always work for you. First one is eating dates. You want to eat 6 dates a day for about 4 weeks. So the idea is that does something to enhance stuff that helps soften your cervix, which this is just how this sounds. They have an idea of how it works, but they're not exactly sure. But they do show that people who eat dates are less likely to need an induction, and usually their cervix is a little further along once they go into labor. Quick reminder, if you absolutely hate doing these things like eating dates, don't do it. If you're just like muscling through it, I think that may have more negative consequences than not eating the dates. Just a quick reminder. The second one is perineal massage. They have shown that when you do perineal massage, you're more likely to not need an episiotomy. I've also seen studies that say it reduces 3rd and 4th degree tears. And I've also seen other studies that show that in postpartum, you're less likely to have more pain in your birth canal area. And I should also say, if you're like, how do I do that? I actually include all of that in this article. I also include the studies that I'm going through that point to why these things help. The third thing is to keep working out, and that includes doing things like squats. Studies are showing that when you're doing those things that really help to open up your pelvis, rather than like walking or sitting in a chair, it really helps baby descend better. I think there's a lot of prenatal workouts out there that are really helpful, but if any of them are hurting you, I would recommend talking with your provider, possibly seeing physical therapy, because I always wonder if some of the squat and things I was doing was actually making my symphysis pubis dysfunction even worse. So be sure you're checking with your provider before you start doing a workout. So those are 3 things that evidence shows can help make labor faster or easier. What are you trying to do to make labor faster or easier? Or are you even worried about it? Tell us in the comments.